Greetings, people of tomorrow. Hello, everyone. Let me introduce myself. My name is Derren David, and trusted as the Director of Academics of AMSA International 2023 and 2024. First of all, welcome to the second series of the AMSA International Podcast with the topic of Qualitative Insight in Public Health Research at the Forefront. In this episode, we introduce our amazing speaker, Jessica Gloria Mogi, an accomplished public health professional with the aim to explore AMSA International, offering insight into how members can maximize their potential within the organization, specifically in the field of academics, and in this case, qualitative research and public health. Jessica, with her extensive background and expertise in public health, will share with us today her valuable perspective and knowledge. To listeners, particularly those who are interested in advancing and understanding more regarding qualitative research and public health. So, I think allow me to give a brief introductory CV about Dr. Jessica Gloria Mogi. Dr. Jessica Gloria Mogi is a highly qualified professional with an MPH from Johns Hopkins Bloomberg School of Public Health and a Doctor of Medicine from Samratulangi University. Her experience includes roles such as the technical officer for the USA EPIC project, graduate research assistant at Johns Hopkins, clinical coordinator at Dr. Share, and medical doctor intern at several institutions. She has numerous publications and presentations in public health and medicine, demonstrating her expertise in this field. Additionally, Dr. Jessica has been involved in various professional organizations and volunteer activities, showcasing her commitment to healthcare and community service. And joining us today, without further ado, our amazing speaker, Dr. Jessica Gloria Mogi. How are you today, Doctor?
It isn't splendid, but I'm doing great. Thank you, Darren.
Well, first of all, once again, on behalf of AMSA International, I thank you very much for your time today, Doctor, for coming to this podcast. Um, Before we move on to, well, the more interesting part of our podcast, could you perhaps introduce yourself a bit briefly for our listeners at home, maybe?
Okay, so actually, you have done a great job in showcasing what I am, what's relevant about me. But what I want to tell more to the people who might probably be seeing me here for the first time. So I'm currently assuming the role as the technical officer of the HIV clinical services in EPIC Indonesia, which is one of the um, globally global project funded by the USAID. The main implementer in Indonesia is the international NGO FHI 360. We are working together with the Ministry of Health, Department of Health in provinces of Jakarta and Greater Jakarta to accelerate the response toward HIV in Indonesia. So previously, I graduated from the Johns Hopkins Bloomberg School of Public Health with my MPH in Social and Behavioral Sciences. So that might explain why I did some qualitative work. Mostly what I did there, my research was surrounding food, nutrition, and also HIV prevention. But at the same time, I also am interested in other issues such as non communicable diseases and mental health. I have an organization that I built together with some friends, which is based in Manado. It was a youth community called Be There Manado. So you can check that on Instagram, where we tried to focus on awareness raising among the youth in Manado regarding mental health issues. Thank you.
Thank you very much, Dr. Jessica. What a really extensive background that and experiences that you possess as doctor. So allow me to perhaps ask for our first starter questions. Um, since you come from a background of public health, how would you say, in this case, perhaps since we talk about qualitative research, we're going to talk about qualitative research. How has qualitative research influenced your understanding of public health, doctor, if I may ask?
Sure. So I graduate from the same medical school as Darren, but we're I think 7 years apart, which means I am old. But what we get from medical schools, the majority of things that we know about public health is mostly our 6 to 10 months rotation in the Department of Community Medicine. And so what they gave us there is mostly about pretty quantitative thing. They told us how to count mosquito density in a container when it's time to face the dengue outbreak. They told us how to count the water quality in response to environmental health threats. It's something like that. But while it is also important, we were never told how a qualitative perspective could actually add into any intervention that we craft to prevent public health outbreaks or public health issues. So, for example, when I got into my so after graduating med school, I did my internship and then I went to work in a very remote area in Kbasar Island. So many of you have not heard where that is. That is a small cluster of island that is located in Southeast Maluku. It was right under the beard of Papua Island. So there, the things that we learned in community medicine, while some could be implemented, some could not. It could be because of the lack of infrastructure there, the lack of support of the local government, but it could also be because of the acceptability of the method of prevention or the method of treatment for the people who are the target population of the intervention we're going to give there. So while I work there, I assume that, well, turns out it doesn't only take, theoretical knowledge, practical implementation, but it also takes what the people who we aim to give the intervention to think of the intervention. So the place I worked at in the Dr. Share Therapeutic Feeding Center, we focused on stunted children and mothers with chronic energy deficiency. You know that the government of Indonesia has been successfully able to give supplemental food provision, right, to the stunted children or the mothers with chronic energy deficiency. They have rolled out their iron tablets to prevent anemia. However, there is still a high prevalence of those conditions in Kbasar Island. And so if you keep on going with the mainstream kind of intervention that the government has already given, you will not know what is happening on the field that is not making this work. Like why are 21% of the mothers still have chronic energy deficiency while they always go to the Poshando every month, right, to get their pregnancy checked? So what's wrong? And so afterward, when I tried to delve more into the qualitative aspect, when I returned to Kbasar Island a year later, when I was in Hopkins and did my research, I found out that a lot of food taboos and practices actually got in the way of them consuming the supplemental food from the government, of them actually, wanting to consume the food high in some proteins. So, yeah, I think when you are going to make an intervention, you should take into account those kinds of thinkings from the local population. So you can actually give them food that they think they can consume while at the same time the food is being nutritious, something like that.
Well, thank you very much for such an extensive answer, Dr. Jessica. So I think the key thing that I managed to capture from your very insightful answer is that qualitative research offers a rather more personalized approach compared to quantitative one. And as you have mentioned earlier, I actually find it very surprising when you mentioned that the government has been giving them supplements and all the adequate stuff needed to deal with chronic deficiency and such. However, the prevalence is still high, and apparently such issues cannot be addressed through quantitative method, and you have to do qualitative method. Is that correct, doctor, from what I infer from your answer earlier?
At the end of the day, it could work, but you have to also, do a more tailored individual approach. So if you go to a population and then you find out, oh, they don't want to consume that based on like these contextual issues. For example, they think that consuming something external to what the nature has provided you could be harmful for your bodies. So if it's something like that, then you can introduce them other um, interventions, right? Maybe the iron tablets they don't want, but you can introduce them to foods from the nature, like vegetables that is high in iron content, so they can still get the needed iron to prevent anemia, for example. Or maybe other context offers you other problems. For example, they consume the tablets, but then when they receive it from the government, they took the tablets and defied it to their children, for example, or their other family members because, well, the government said it's good. So it's not good for me to just keep the benefits to myself. I also have to share. Then you have to go through and go through like the population, provide them more like counseling or more socialization of what it is good for, because sometimes the problem is different in each population. So this is what's interesting from qualitative, right? You are there to get the more emic or like inside thinkings from the population. If they think it is this problem, then you approach that with a different kind of intervention. If they think this is this problem, then you do another kind of intervention. It could be a problem in knowledge, acceptability, and like beliefs. So there are different behavioral approaches that you give to different constructs that are the barriers, in the health intervention.
Well, thank you very much for your answer, Dr. Jessica. But so if you will allow me to ask more regarding the your experience in qualitative research, well, from the main thing that I could really very much infer is that qualitative research is actually more personalized and specified, as we have talked about before. But when put well side to side with quantitative research, as is the norm in medicine, how would you describe? Could you perhaps describe the main differences and the characteristics difference between qualitative and quantitative research for maybe our listeners who are first time hearing about this qualitative research, Dr. Jessica, if you don't mind?
Sure, sure. So yeah, as is the norm of medicine is, a lot of professors, I'm not saying it's wrong, but then I think it's the environment that has been set in our institutions. So a lot of people think if there is no, statistical correlation between something, then it is not a research. No, it is. So I think the main difference is that as quantitative talks about more about numbers, and so they focus on representativeness, they focus on generalizability. And so that's why they try to sample randomly from a huge population and then have their sampling frame. And then they come up with a sample size. Let's say it's 1,000 people who are of the same characteristics, and they try to prevent bias. That's why they try to sample randomly, but from the, let's say, quite a homogeneous people in the same population, right? So you have to say in the sampling method that you are choosing 1,000 pregnant women from a population of village in this island. So it's like pretty much a homogeneous sample of a size that is good enough for you to take an statistical inference and for it to be representative to, like, the larger target population. So maybe you take from like 10 villages, each villages has like 200 people, so on and so forth. And in qualitative, you don't have to go with such big sampling size. If you have the people and the resources, great. So like recently I got the chance to hear from our colleagues in University of Indonesia who are conducting a research on PrEP acceptability among providers and users, and also community field officers. I think they have more than 100 samples from each population group. But if you have the time and the resources, great, but you don't have to. So sometimes you may encounter papers where the population is like 20 people or even like 8 people whom you interviewed separately in different occasions. And that is okay, because what we're trying to find here is their own point of views, and it doesn't have to be homogeneous. It is better if it is different. Interestingly, in qualitative interview, we know about maximum variability in terms of sampling. So you find people who are, well, various. If you are talking about um, how do you fix a car engine that has broken down in the middle of the street, you don't just go to like mechanics and then like you interview 10 different mechanics. You can go to mechanics and then people who are just lay people but have fixed cars in the past. You can also interview passengers. For what? So that at the end you have different point of views that you can triangulate into a conclusion that you present to your readers. So that is the difference. You don't find a lot of people to make it representative. You don't try to prevent bias, which you do a lot in quantitative thing, but in qualitative you don't think of anything as quote unquote bias, because what the people think, it added a nuance, it added a context into what is going on. You are not trying to like, you don't have a hypothesis at the start, right? Because in a quantitative interview you might think that you are going to reject something as like, if you think this causes this, maybe you're conducting the research to reject that hypothesis. But in qualitative, you actually come as an empty vessel, right? You are trying to learn from the people, and then what their point of views, you absorb that into you. You are just reporting that back into the community. But it doesn't mean that you are not implementing any method. You are still doing like things so that you prevent injecting your own point of view into them. That's called reflexivity. So you think and you reflect and you write extensive field notes at the end of the day, every interview. So if people are trying to say, you're just conducting interviews, you're just conducting like qualitative interviews. No, it is very tiring on its own. So we should not belittle any method of research, right? Quantitative is great, qualitative is also great on its own.
Well, thank you very much, Doctor, for your answer. And I think I understand far more better, especially with the whole car analogy thing. It is such a really it really helps me in understanding. So, Doctor, if I may wrap the conclusion of that of your previous answer is that I think the main key difference between qualitative and quantitative is that in perhaps in its sample size, in its population, whereas qualitative it can be not too much, while it's quantitative it's usually have to be far more representative compared to qualitative one. And yes, I also agree with the point of view that you have shared earlier, specifically in quantitative, we actually try to prevent bias a lot on especially on the heterogeneity, while on qualitative, apparently we embrace bias. I mean, heterogeneity, not bias. Well, I think thank you very much for that answer, Doctor. But it actually leads me to another question since you have explained so extensively about qualitative research and quantitative. As per your answer, it is such a different field, qualitative and quantitative, right, Doctor? So, how what are some challenges that perhaps you have encountered whilst performing your qualitative research, and how exactly do they differ from quantitative one? I mean, I am aware that you have mentioned earlier qualitative it's usually more time consuming since you have to pay a very particular time to in each subject, very different to quantitative one. But could you perhaps elaborate more on that, Doctor? Thank you very much.
As in challenge in like conducting the research, collecting the data, is it?
Yeah, I think I would say in collecting the data and in formulating the manuscript for, let's say, the research report, the thesis, Doctor.
Okay, sure. So collecting the data for sure, you do have to have your time and resources, right? And you also have to do your previous literature research before you actually dive into the community. In some very seasoned researchers who are very theoretically inclined, they might spend a year living in that population and just talking to people in general, talking and talking like a normal person, sitting in the bar, gathering information, but they're actually taking data and then they go home and write down in their field notes. So also because of that, you're trying to not quote unquote disturb the population, right? Because you are here, you could be an observer participant or you can be a participant observer. What's the difference between the two? If you're an observer participant, you are already in that population and then you write down your notes. So you can be a doctor and then you are conducting qualitative research about the behavior of, let's say, the medical students, then you are in a population already. So it might not be as hard as, outsider observing the medical students because they will not try to change their responses to you. Like if you talk to them and then you ask, what do you think of our methodology block? Do you find it difficult? Then they will give you an honest answer. They will think like, yeah, that's freaking hard. But then if you come as a participant observer, and then let's say you're actually a professor or an assistant professor, and then you come into a group of medical students trying to collect qualitative data, and then you ask, what do you think of the methodology block? And then they're gonna say, we think it is okay if you try to read more about that. So that's called a desirability bias. Now, to prevent that from happening, you have to mingle into the community. So this might take a longer time, right? You have to be able to join the population, and then you in the process you will try to adapt what they're doing every day so they can open up more to you. And so that is one. Also in the collecting the data for sure, because you don't want them to actually give you a different response, like a more fabricated one. You sometimes some people, they don't want the interview to be recorded. They don't even want handwritings, so that's a challenge. Or sometimes they're okay with recording but you cannot write but sometimes you have to write, right? You have to write the people are gathering in the village and then wearing red clothes signifying this, but then you can't do that if they ask you not to, so you do have to have a really strong memory. It's great to have a partner going with you, because at the end of the day you can have a peer debrief with them, so the things that you missed they can let you know what those are. So yeah, back to resources and then back to your memory. And then at night, after you interview like 10 people in a day, it will be very tiring, but you still have to sit at night writing your field notes. You might have like a little scrabbles on your book, but you will need to expand that as detailed as possible. So like, because that will become your transcript later, right? Which you will then code and analyze. So it couldn't wait. Sometimes it could be like early next morning, but the best time to do that is late at night after you finish all your activities for the day, so that you don't forget. And like everything that you pop into your mind, you can write it straight away on your note. So that is about the data collection. About writing the manuscript, I think you will have to implement a lot. You have to look at different journal. It's actually pretty similar to like quantitative research, right? Like every journal have their requirements, but for qualitative, it could be like this journal is very theoretically inclined. This journal is more practical, and you can choose where you submit. Sometimes the hard part is that you have to cut a lot of words, which is hard because you will put on the quotes from the participants, you will put your study setting description, especially if it's like a remote place people have never gone to, and then you have, let's say, 7,000 words, and then they say the limit of words in this is 300, is 3,500, so you have to cut down like half of it. So at times you have to journal hop, find other journals that fit your requirements. If you think that cutting down half of your manuscript is okay, then go for it. But personally, I don't think that's okay. So like you have to journal hop. And then after you journal hop, you find a most suitable one, you submit. So this is a bit of personal experience, but in 2023, I haven't published anything, even if I have submitted in three different journals. One of the problem is they find it hard to find an editor that would take on the project, because as qualitative research is very nuanced, maybe they don't have anyone they know in their board of directors who have that expertise, and then they have to go out and invite other editors. So that's another time. And then if an editor said yes, they might have to, take time inviting other reviewers to look at the manuscript. So yeah, I think that's the challenge, because it's very nuanced and contextual. So you will have to find someone who understands that kind of nuance, right? That kind of research.
Thank you very much for your answer, Dr. Jessica. So I think first of all, I managed to infer that apparently you are a night owl, then I would assume, since you like to do things even though late at night, even though when you're tired. And I think a second thing that I found is actually very fascinating is the fact that you have to have a strong memory to be able to do qualitative. So does that mean if you don't have a strong memory, you cannot do qualitative research, Dr. Jessica?
You can. In fact, I'm kind of forgetful myself, but the last time I went, I have a partner. Like I have a co-investigator, so that really helps for the peer debriefings. You also have to, if that helps, you may have to have like a local counterpart. So like the people from the population, so you will be able to reach the your participants better. And so if you do that, I was kind of lucky that I was able to record. You will need an informed consent for that, though. Either it could be verbal or it could be like a written one, like the normal ones you have. But I had a verbal one. I did have to create the script though and submit that to the IRB as well. But because of the local counterpart, I was able to actually record. So that's really important. And then after that, you will try to you can still write down things as well. So even if you cannot write extensively, write this, right? People will think you're not listening to them, but at least you can write down the environment, like where the interview was held, and then how many children maybe the participant is having. Did the interview go well, or the participant keeps on being distracted, and take care of the children, something like that. You can write briefly on your note, and then at night you combine the transcripts from your recording and uh, and the field note that you have, then you expand it, even though the full transcript will not be done in a day. That takes very long. So, okay, I think that's also one challenge, right? After that, you have to transcribe the recording. That takes another. So, like, if the interview is like 1 hour, it might take like 6 hours for you to actually transcribe the whole recording. So, yeah. You
So in addition
feel,
to have a strong memory, you also need to be able to endure the pain of transcribing pretty much. I think that's the one thing that I also catch. And I think
yes. So the sad thing, I
yeah.
was poor, right? I was like a very young researcher. I am still, I'm young, but then I was poor. So if you have more funds or money, or like maybe some of you won some grants, of course, there are transcribing services out there, right? So you can actually hire local people who can write and who can read. You can hire them as like a temporary research assistants to transcribe and code the interviews for you. But and also there are like paid transcribing services if the interview is in English or in Bahasa Indonesia, or like, common national languages. You can use those services to transcribe. Well, the thing is that back then, my interview was conducted in a local dialect, so those services, of course, they don't work. And I was poor, so I couldn't hire anyone to be, a transcribing research assistant. But yeah, all research goes back to money.
Well, I think no truer statement has been delivered. Speaking of statements, I also remember what you said about, you have to shortening your manuscript in accordance to the format of the templates given to by the journals. I can relate very much to that pain, doctor. It's such. So I think, doctor, my next question will be from your point of view and from your personal experience, right, doctor, what emerging trends that have you seen currently growing in qualitative research in public health? And how would you say these trends align with the global health needs and challenges?
I have seen recently, I think in the past year, there are more research that actually utilize the mixed methods. So they have a quantitative component, but they also have a qualitative component. So there is a kind of explanatory mixed method research. There is also an exploratory mixed method research. So for example, you are conducting a survey among the people who maybe use bed nets for malaria prevention, for example. Your survey is the quantitative component, and then afterward, you interview the people who use the bed net. So let's say 20% of people uses bed nets for malaria prevention, and then you interview this 20% of people to find out why they choose bed nets compared um, to other prevention methods. So this is the qualitative component. I am seeing more research is conducted this way, which is great. Mixed method is kind of hard to implement because you will be needing more time, more people to conduct the research, the quantitative part, the qualitative one. And it was great because it's able to explain why 20% of people choose to use the malaria bed nets, and if maybe we can take their motivation to use that intervention and implement that in other prevention methods, or try to influence the remaining 80% to use bed nets for malaria prevention, right? There is also something called exploratory studies, exploratory mixed methods. You actually do the qualitative part first, like you interview people, what are your preferred malaria prevention method, and then afterward, if you find out that a lot of them mention bed nets, then you do the survey, and then like you try to distribute bed nets and then see if a lot of people actually use them or not. And if they use that, you do another survey about like from 1 to 10, how much will you rate, the ease of use of bed nets or the effectiveness, something like that. I've seen like more papers implement that in terms of like qualitative research is being more used, which is great, because that way you can put quantitative and qualitative hand in hand, so everyone is happy. And so more and more, I think it's also because of the difficulty of entering some journals. So some journals are really heavily theoretical, like social science and medicine from Elsevier, it's really heavily theoretical. So you have to like write a lot of pages explaining the justification of the research in alignment with the existing sociology related theory. So because that is kind of like hard, the people who go there are heavily anthropological people or like professors who have been like in that field for like many years. But then there is something in public health programmatic point of view or lens that utilizes qualitative method, just not as heavily as that one. So usually it is to solve a relevant public health problem. So if you're saying that what is the role in like global health issues, then the more programmatic side of the qualitative research in journals such as the Public Health Practice or the WHO Health Bulletin, they are doing qualitative research that is more inclined to the hot topic nowadays. So like um, for example, like COVID-19 vaccine that day, and then and then they do qualitative research interviewing, for example, people who have been the recipient of Sinovac or like Pfizer or like what's the other one, Moderna, and then they try to ask like, why do you prefer this over that one, and then what kind of side effects, and then what takes you to like inform other people to be vaccinated. Those are the kinds of things that fit more into the programmatic lens of qualitative public health interviews. So they go after the hot topics to be able to expand the current or the upcoming intervention even more.
Thank you very much, Doctor, for such an extensive answer that you have given. So I think, if I may conclude from your answer, is that the emerging trends in qualitative research that you have noticed, especially in public health, is that actually the rise of mixed method where qualitative and quantitative goes hand in hand together. And I think I would also agree with you that I think for the longer part, if you want to do an extensive explanation on a topic, I think quantitative should be combined together with qualitative, as quantitative can explain the statistic, but it cannot give further descriptive details. So I do agree very much with what you've mentioned, Doctor. So if you would allow me one last question, Doctor, if you do not mind. Unfortunately, since we are limited by the time, even though I still want to ask a lot, Doctor, um, what message would you like to leave for our listeners who are maybe aspiring future researchers, or are those who want to start studying or doing qualitative research? What message, or perhaps some tips and tricks that you are willing to share with them, Doctor?
The message, I think one of the most important thing is, I know you all come from a heavy medical background, and maybe, well, I do too, but then maybe that kind of influences you to think really numerically, because you're like prescribing things, and then you are always thinking in a, a flow of a guideline if something happens, so if you're trying to do qualitative research, try to take that out of you. Do not say that, oh, this person is saying a valid thing and this person is not. You are actually at no place to judge if something is valid or something is not. If you're talking to a community that you have, especially if you have never been there before, you're only there to take what they have to offer you, and you have to take that as part of your data, right? And then there is no such thing as like what do you call it, like a sampling frame has to reach that certain number of participants for it to be valid or for it to be normal distribution. There is no such thing in qualitative research. You do have to think of recruitment strategies though to find the people with the maximum variability, so the sampling is pretty much purposive. And then if you are interested in trying to research something qualitatively, always do your reading first. So you don't, even if I told you you have to come as an empty vessel, but it doesn't mean that you don't know anything about the community. At least you know like their demography and then some important cultural things there, so you can practice something called cultural competence or cultural sensitivity. You don't want to go there and piss off the local people, and then that led you to, being told to leave the area, because then that would be the doom of your data collection process. So be nice to the people around, and then respect the culture they have. Okay, that's for me.
Thank you very much, Doctor. So I think on the last summary that I could actually infer from the statement that you have given is that for new researchers to be, well, as performing any research, to be prepared and to at least do some readings regarding the topic that they are going to bring, and in this case perhaps for qualitative research to be able to do, well, a better personal approach, especially perhaps if they want to do in communities. Well, thank you very much for your answer for the question, Dr. Jessica Mogi, and I think that is all for today. And it is really great to have you, and I learned a lot from you today, specifically in the field of qualitative research and public health. And I hope that with this podcast, every listener here will also learn more about qualitative research in public health. So thank you once again, Dr. Jessica Mogi, and I also thank you to all of our listeners who are listening wherever you are. I wish you all a very pleasant day.
Thank you, Darren. Happy holidays to everyone.